Thanks very much for that introduction, I think. I'm here to moderate today's discussion about the counselling process. I have with us, we have Miranda Montrone. She's a Sydney psychologist, a family therapist, and infertility counsellor with more than 27 years of experience in infertility and assisted reproduction. Since 2001, Miranda has worked in private practice, and one of the most experienced with surrogacy cases. She's assisted over 120 surrogacy arrangements, undertaking psychological assessments before treatment or attempted pregnancy, as well as post-birth counselling and reporting as required by New South Wales legislation. And Miranda and I have worked together on quite a number of cases over the years. And sitting next to Miranda is Katrina Hale, who is a psychologist and infertility counsellor. She's a Sydney-based psychologist with over 20 years counselling experience. She's passionate about surrogacy and a strong supporter of all walks of the community that wish to create a family through surrogacy. She is committed to helping intending parents and surrogates and their partners successfully navigate their surrogacy journey together. And then, last but not least, is Michael Condon. He's based in Brisbane. He's a clinical adult and child psychologist, stroke counsellor with 35 years of experience. Gee, I'm trying to add up all those years of experience that we've got on the panel. It's really quite impressive. He has a strong interest in both surrogacy and has assisted many couples and traditional and gestational surrogates in pre- and post-journey counselling. Well recognized and respected in the professional community involved in infertility and counselling, Michael has seen both failure and success. Haven't we all? Well, I thought I'd kick off by saying that, being American-born, Americans love counselling. But in Australia, counselling has a little bit of a dirty, it has not such great connotation. So it is sometimes challenging to get people to see a counsellor. But I thought we could just talk about what the counselling process means in the context of surrogacy. What are your aims? And maybe Miranda, you can kick us off.
We heard yesterday was really interesting, a lot of people speaking about the value of counselling and through the surrogacy arrangement as well, which is a really good idea. But those people were people that were already through or past and there'd been maybe problems and they'd realised it. But often when people are first told they have to go and see an independent counsellor for a surrogacy report, they feel it as if it's an impediment, and they've often spoken a lot with their surrogate and they've looked at all the issues. They often think that they've done pretty well everything, though I usually find there's at least one or two issues that are considered in much more depth. So there's counselling before required, and in New South Wales there's a requirement for the counsellor to assess suitability, which is an interesting word, but essentially it would cover the sort of things you'd expect. And then there's counselling required after in New South Wales, and in most other places it's not dissimilar. And now you heard yesterday too in terms of the benefit of counselling during, and I found that too, because often when you do the assessment counselling before, people, they're on their best behaviour. They want you to write a good report, and even though they know that you're on side and helping, they don't tell you everything. But once there's a pregnancy, they'll come back and they'll say, actually, we forgot to mention this, and this has popped up, and it's really good to do it then as well.
So, often people, like Miranda said, they view the counselling as an impediment or something to be feared, but I see it more as an opportunity to make sure that you're really well prepared for surrogacy, that everybody's got their eyes open and their head screwed on. They've had that opportunity to think through and discuss all those big, heavy issues before they enter into a surrogacy journey together.
One of the things, again, is there's lots of different state laws, unfortunately. So surrogacy in one state requires different emphasis on counselling than in another. For an example, in Victoria it is very much an assessment process. In New South Wales it's a assessment/support process. I think in Queensland it's a lot more just a support process. It's required that you undertake counselling, but whether the counsellor agrees with it or not is irrelevant. The law just says you've got to turn up at counselling. So I sort of see counselling more as that supportive role, that's finding out what things are really useful to do, making sure that everybody are on the same page, and being able to address issues that sometimes are a little bit hard for people to address in the, for want of a better word, privacy of their own home. You've got to ask the hard questions sometimes. It doesn't mean that just because somebody comes up with one answer or another answer, that answer is right or wrong, but it has brought everybody on the same page, because to me one of the biggest things about surrogacy is honesty, openness and communication and trust. If you don't have those 4 things, forget it. And that has to be ongoing. And I think counselling's there to try and enhance that. I think the other thing about counselling is I think it would be very helpful for people going overseas to actually get a bit of counselling in Australia beforehand. Again, just to look at what the dynamics may be for them and their understanding of it. Yeah, I can't give information on visas, I don't try, but I think it would may be helpful in terms of looking at, well, these are some of the emotions that you may go through, rather than we're checking that you need to go through these emotions. It's not a check, it's assisting people.
It's a lot of people you're trying to get on the same page, though, isn't it, potentially, right? It's a minimum of 3, really, the intending parents and the surrogate, but then the surrogate may have a partner, and then you may be dealing with an egg donor who may also have a partner. So you could be dealing with up to 6 people who have a very intimate relationship, and then, of course, there are the extended people. So how do you manage to deal with all that, juggle all those balls, and get people on the same page? And how do you start that process?
Well, that's, part of the expertise. I'm a family therapist, and you've always got the whole family in your head. And can I add in the children of the surrogate as well, and the children of the egg donor? It's not that they all have to be in the room, but there are implications. For the egg donor, their half-sibling's going to be there. For the surrogate, their mum's going to be going through a pregnancy and the implications for that. And the other one that's in the room, 1 or 2, or sometimes 2 we've heard, is the future children. So it's talking about, okay, all of the people and what are the decisions and how is this going to affect that person, and that's bluntly the many years of experience that's there. And it's not a critical or challenging thing, it's more just let's consider the implications of the decisions that you're making and where you're going.
And some of it's in how you do that process. So it's not just seeing everybody as a group all together and then discussing all the issues, with everybody there in the room. Some of those discussions are with people as individuals. Some of those discussions are with each couple together, and then some of those discussions are with everybody together as a group. And there's different things that I would speak with, with the couple. Different things I'd speak with the group. Some of the issues raised, with each couple might be then things discussed as the group. So that's really in the process. It's quite a structured process that I follow in doing the counselling to ensure that everything is covered off, as opposed to being more like a supportive style counselling that I might do in therapy, which is more client guided. It's a very structured process that I follow.
I'm probably a turtle from the point of view of using electronic media, but I've really taken to emails in a big way, even though I avoided them for years and still had a fax machine. Those are those things that used to generate paper. I don't use Facebook or Twitter. I don't know how. I'm sure my children could tell me. They're adult now. But what I find is one way of handling it is about 4 weeks before I see people, or longer if I can, I send them out every discussion point that I'm going to raise and send it out to everybody involved, and then ask them to sit down and all talk about it as couples, as individuals, and between everybody, so that they're very aware what I'm going to be looking at. And that gives them, and they've already discussed it. It's not new to them. I'm not going to jump down their throat on anything when they walk in the room. And I think that really helps, because by the time they've walked in the room, they've got a pretty good idea. And what I also asked them to do is actually respond to each of those in writing via an email response. For each couple or each whatever. So really they've had to not just sit down and think about it, but they've actually sort of say, well, hang on, how do I put these thoughts into words? Now, I'm not trying as an assessment report, but what I'm doing is really sort of saying, I want you to really think about this. And then when they do send it back a week before, I might ring them up or email them and say, look, can you have a little bit more look at this, or can you have a little bit more look at that, please? And then at interview, I'll go through all of those things again. But it's not in terms of you should be saying this or you should be thinking this. It's more in terms of looking at again, everybody's on the same page. They've covered points that are too hard. Look, everybody's raised, everybody needs to look at whether people would terminate, what to do here, what to do there. They're all the what ifs, and some of the what ifs aren't very nice. What if the recipients or intended parents, recipients, whatever, what if they die beforehand? What are you going to do with the child? Because they're the worst case scenarios. If you can think of the worst case scenarios, then the easy case scenarios are dead easy.
Sorry, I just thought of something in addition, because like in New South Wales, there is a requirement to write a report about suitability, but whilst it's an assessment, counselling, for me, and I make it very clear to people, there's no question, no silly question that you can't ask because of the experience I have, I can help. But the big thing for me is very much, it's a really, really thorough informed consent process, exactly like Michael is saying. So there is a report written, people see the draft of the report before the final thing. So they see this expert outside who, I do have a lot of expertise and I know the world and know some of the pitfalls. So I write this very thorough report and people see it. So they see this is the people we're doing it with, this is what we're doing, these are the things we've talked about, things like prenatal testing, these are what we've talked about now. If glitches unfortunately happen later, this is what we said when we were at that page, and they can refer back to it. So it's really, really thorough, fully informed consent. And then if people go ahead, it's like they've done all the thinking and the talking, it's documented, they've seen it, and then they can say, right, let's go ahead, and exactly like Mark Dodd beautifully said before, then you've done all your research, done all your preparation, and it's realistic optimism. Let's go, and hopefully it works.
And I'll just add something to that as well. There might be something which you think, oh, this will be an impediment to surrogacy. There's no way if I tell a counsellor this that they're going to let me through. Or, if my surrogate's got this aspect, then, that's certainly going to, be an impediment to surrogacy. But I really see the things that there's nothing where you can't put in a management plan. So it's a lot better that you talk about, that you be open and honest with the counsellor about everything that's going on. Then the counsellor can identify if that's a potential risk and then see, well, how are we going to manage that risk, as opposed to you keeping things secret and then that turning into a pitfall for you throughout the journey. So it's not, people talk about red flags, but red flags are just, flags to indicate. They're not stop signs.
Right. Having said that, with all those, 60-odd years of experience among you, can you think of any cases that might have gone awry and what flags were missed?
Well, yeah, I mean, the risk factors that I see, so for the surrogate, is when she doesn't have enough support. So that could, it doesn't matter who's providing that support, but the surrogate needs to have her own independent support. The intended parents, they're not there in the middle of the night. They might be interstate. So the surrogate needs to have family support or a network of support that she can turn to that's independent of the intended parents. For intended parents, if they're unrealistic in their financial expectations, that can be a risk factor, because one of the things, there's also a financial relationship in surrogacy where the surrogate is having her medical expenses reimbursed. So that can be a tricky relationship to negotiate between intended parents and surrogates. If the surrogate is sort of feeling like, oh, hang on, there's, I know my intended parents are, in financial stress, so I feel really bad about asking for this, $10 parking fee to be reimbursed. So there has to be a really realistic expectation on the part of intended parents in terms of the scope of costs, and also what those unpredictable costs might be, so that then they're not just thinking, oh, well, all I've got to pay is IVF clinic fees, counselling and legals, and that's it. There's a whole lot of other things like maternity clothes, pregnancy massage, medications, and all the little things that go wrong, all those incidentals, which can be, if the surrogate puts herself out of pocket for those, that can cause a huge risk, a huge strain on her family budget, and they're not something which she should be out of pocket for. If there are, I see pregnancy-related expenses as if the surrogate didn't, if she wasn't pregnant or wasn't doing surrogacy, if she, she wouldn't need those things, so therefore they're a surrogacy-related expense.
I probably don't get too concerned about the Mars bars, I'm sorry, but I'd leave the costs, etc., to the lawyers. I've had, or I suppose in my history, I've had one surrogacy go horribly wrong, where I've racked my brains and talked to my colleagues in terms of what went wrong, and there's nothing we can identify beforehand. Yes, there were lots of red flags, and the red flags were not the thing that actually went wrong in the first place. What went wrong was a breakdown of honesty, trust, openness and communication. Simple as that. Again, I'll go back to if you don't have that. In that case, the baby did not get handed over to the intended parents. The baby was handed over to some other parents. The woman did not keep the baby, but she was very adamant. If I can't trust these parents, how can I trust them to raise this child? So I kind of think, remember, someone going through pregnancy, I'm a male and I think I can say it because I've suffered a few people going through pregnancy in my life, partners. They become hormonal and become more hormonal over time, but equally people who are recipients also, I think, become hormonal over time. And come the reality, rationality decreases as you increase into pregnancy. Now I know that's a pretty sexist thing to say, but I'm kind of along the lines of, I think a lot of people would agree, not everybody is as sane as what they would like to be by the end of pregnancy. And so therefore realise something that's small and insignificant can become big. Another area where I saw surrogacy go wrong, even though the baby was handed over, basically it ended up in the family court, and they finally came to a consent order, is where same-sex guys and the surrogate and the partner didn't have any counselling. They slipped through between the cracks in the laws, which was a transition stage, and all of the things in terms of, well, what was going to be the future expectations, what were going to be the future relationships, what was going to be the future contact with the child, were never discussed. And I'm sorry to say, there's a family court order that nobody's pretty happy with, but that's the order, and end of story. Child goes between two houses, end of story. And I kind of say, look, to me, counselling probably would have got rid of that. It would have been a much easier transition.
Miranda, do you have any...
I've analysed, again, that the suitable word for me, I've decided it's, no mental health problems, no coercion, no implicit or explicit, because it can be a bit of pressure on a known surrogate who's, say, a family member. There's a belief that you have to have a sister. It's commonly stated that you have to have a sister or sister-in-law to do altruistic surrogacy in Australia. I've analysed the 120 cases, and 44% had sisters or sisters-in-law, but over 50% were further extension, friends of friends, extended family like cousins, distant cousins, people who heard of the need and offered. There are people out there. I know there's this. It's commonly said it's hard to do. It takes a bit more time, but the longer term outcome can be particularly positive. My point there is the suitability. As you know, like there's no substance abuse, no criminal conviction, so there's more care. The counselling beforehand in altruistic surrogacy is more there's more like if you go overseas, you don't have counselling, and accept the lovely process that Kim Bergman talked about in the States. That was terrific, very similar to what we do here. So out of the 120 cases, only 2% were, I decided, not suitable, and there were significant problems with which they agreed. There were another number, so it was like 4 out of 5, no problems, everybody totally on the same page. The other ones were indicators of flags and sort of like, oh, let's put in a plan of action for this potential pitfall, which is the whole point of the counselling. There are pitfalls that are there. Our job is to help pick them up, not to be mean and horrible and negative and a blockade, but look, just be aware of that. So how are you going to handle that? And back to Michael just saying that if they'd had that, probably it would have helped.
I think we've got about 5 minutes now for questions. Yes, here.
So one of the things that I've really taken away from this weekend has been people talk about the pros of having counselling throughout the pregnancy, which I'm quite interested in. And I was wondering if you find people come back to you if you've done the pre-counselling, pre-pregnancy counselling, or whether people choose their own independent counsellor to talk to.
I'll answer it. Yeah. There was a time when Dr. Stafford Bell, he spoke today when he started up, and he talked to me ages ago, and I suggested once in each trimester, and I think they do that in Canberra, and there they picked either the clinic counsellor or the independent counsellor. I saw a number of people, and that's where it was really good. People would come back and they'd say, oh, actually, we didn't mention this before, and I'd go, great, now you've talked about it, let's how we handle it. It isn't a process and I think it has actually been suggested there needs to be more supportive counselling. And I also think, though, sometimes people don't want to add a cost to their intended parents. They're very aware of how much it costs. So I'm very pleased this conference has mentioned it, because it's like, yes, it does help, and you can go back to the clinic where you've done the treatment. If you've done it through through a clinic, they have counsellors, or you can see the independent, or you can pick another person. But the people you've known through the clinic or the independent person know about it already. So I think you can choose your own if you want. Yeah.
I suppose one of the things I look at, I recommend people do, but I'm fully aware most people don't, and that's fine. But what I do recommend is, well, in lieu of that, everybody get together at 3 months, 6 months, 9 months, 3, 6, 9 afterwards, and say, we're going to spend 5 minutes just get rid of kids, get rid of family, get rid of idle chatter. Let's look at how it's going, what's happened, and just concentrate on what's happening at the moment in terms of the surrogacy or the post-surrogacy. So dedicate some time rather than the idle chatter, oh, isn't the baby wonderful, isn't this great, how are you feeling, oh, I'm okay, or whatever, of actually looking at each person, how are you going?
In the case of having a surrogate that is a family member, what's the one bit of advice you would give to both the intended parents and the surrogate, because they've got that close relationship?
I think family surrogacy is a wonderful thing, because you already have that pre-existing relationship. You don't have to start that relationship from scratch. So I'm not sure of any particular advice. Have you got any particular advice?
I just find most family members are very happy to say it's your problem, it's your baby, pass the parcel.
Yeah, they do. They say that. Though I do remember one of the very first surrogacy cases I did, and it was 2 sisters, and very happy to help, and the whole stereotypical sister. But the one that was the surrogate said it's the classic, I don't know if you went to the Baby Blue, the post-birth emotions one yesterday. She's in the hospital, delivered the baby. Everybody was so thrilled and excited in the family that the sister who was born without a uterus could finally have a child, that all the attention was on the sister with the baby, and everybody had come in, and it does happen in families, people have told me. So huge amount of attention, and then the surrogate, who was the sister, said, so what am I, chopped liver? Hello? I actually did the hard work here, and everyone's going, oh yeah, great. Oh, isn't it fantastic, she's got a baby. So you've got to be a bit careful about that in families, but people negotiate it. Families tend to do an amazingly good job of negotiating ups and downs, that's all. Yeah.
And I think what Miranda said is the same in any surrogacy. Like, it's really important on that post-birth transition that the new parents can get engulfed in the demands of looking after a newborn, and sometimes a surrogate can be left a bit feeling a bit abandoned and unappreciated. So it's really important to ensure that she comes along for that post-birth journey as well.
Just a quick question for older children of surrogates when they go to school and their mummy is pregnant and then she comes to school and there's no baby. Do you do any counselling for older children on how to prepare questions and queries from other school mates?
I had one surrogacy recently, and the surrogate told her child, her 5-year-old, and that she was going to be the surrogate. The surrogate and the husband did, and she told the child. First off, he went to the school. Well, first off, he said he said he was going to help this other people have a baby. He said, give them the sister, the 2-year-old sister. He thought that was a great idea. He also went to the school, told the teacher that mummy's going to have a baby and we're not bringing it home, and he was extremely excited about it. But the father had the drop-off duty, the pick-up and drop-off duty because of the work environment. So the teacher didn't want to talk to the father because she didn't really know what was happening here. So she tried to get the mother to talk about it, like, is this your husband's child? And yeah, you do. Yeah, children handle it fine. It's just exactly like Michael said, openness, transparency, and also understanding different developmental stages and understanding the ages of the children, where they're at and how they work their way through it. Yeah.
And I'd always advise parents to talk to their child's teacher, so that then if the child is sort of coming out with a story in a funny way, like mummy's having my uncle's baby, then the teacher actually knows the context of what that's in, and then can help the child, facilitate the child in telling that story.
Another question?
I'm just wondering, in your experience as counsellors, I know it might be individual, but with religious beliefs, have you often had surrogates that have been quite strongly stigmatised within their, say that in my experience I'm thinking my potential surrogates' children go to a Catholic school, and so I'm wondering whether that is something that's often actually being brought into counselling that
Absolutely.
surrogates have faced.
I always bring it up, and a lot of people are, it's not uncommon, there's a large percentage of the population are Catholic, always bring it up, and even when children have been at Catholic schools, they've talked about it, as Katrina said, with the school's been supportive. It's like the schools are, I think there's some difficulties in the Catholic Church. It's against the Catholic Church official policy, but the schools are fine about it, and they're supportive and helpful. They have very clear pastoral care that covers all sorts of things, and I haven't heard of hunting in my head. I haven't heard of a surrogate or the children being stigmatised.
I think one of the things too is you've got to look at the local community you're in. I mean, we have a lot of people who come from small towns. Every single person in the small town knows that there's a surrogate, or you can't sort of come home with a baby and say it fell off the back of a truck and I found it by the wayside. It did happen in Sydney, unfortunately, but come to reality, in small towns, privacy is out the window. But equally looking at, the local shopkeeper, the local mums in the grade 3 class, at some stage, for want of, I put it eloquently, the surrogate's 9 months up the duff, and everybody's saying, isn't it wonderful, little Johnny's going to have a little baby brother or sister. You need, the parents, the surrogate need to correct that so that little Johnny's not being asked, well, who took your baby sister away? So it's that preparation. Just again, counselling to me is thinking things through so that you see there's not just a bit in terms of, well, let's get pregnant and work it out and we'll just problem solve as we go. It's going forward a little bit and looking at, well, what is the long-term future? What do we need to plan for? Most people, when they have children, do the bit in terms of, well, I wonder what the children are going to do. Are they going to go to university? Are they going to get a trade? You don't sit there and think, are they going to become a drug addict? Are they going to become a criminal? You think of the positive things, and then you work towards enhancing those positive things, and that's long-term planning. But I think when you're looking at surrogacy, whether you're looking at, egg donor, whether you're looking at sperm donor, embryo donation, whatever, you've also got to look at the long-term things. It's just normal, but it doesn't mean that there's red flags left, right and centre. It just means that, you've got a little bit of extra planning. I'd have to say probably half the people, 2/3 of the people out there in reality, in the general population, probably half of them get pregnant and didn't even know they were pregnant initially, but very few sit down and work out, well, what are we going to say, etc., etc. I do say to people, look, has anyone here actually asked their parents when they actually were conceived? And I would challenge anyone to, if you have, tell me it after or at the end of this, because it'd be quite unusual. But here we are saying to people, you really do need to talk about sperm donation, egg donation, surrogacy, all of those sorts of things. It's different, but it doesn't mean it's wrong.
I think we have time for one final question. We can get
Hi there.
a quick answer.
I'm interested in the practical considerations that you guys have come across with interstate relationships between surrogates and IPs that may live somewhere different physically.
Isn't Skype a wonderful thing?
Yeah, so I understand that Katrina, you're quite heavily into Skype, but I'm interested in the other two panelists' opinions on interstate considerations.
I've done a lot of interstate. I've done a lot of intercountry. Many years of experience tells me that you cannot, and I'm a very experienced family therapist, you cannot do really good group work, and couple work is problematic by Skype. I've done Skype, individual and occasional couple, where I've already known the people or they already know themselves, but I don't agree with a full Skype assessment. I think that there are many cues that you miss out on. But it's a lovely tool as an addition. You know, like a backup and Michael, I use a lot of email to prepare people. But people from different states and different countries, they're usually coming for treatment at a clinic. Yesterday I got asked by some people who have got a surrogate in Victoria and the intended parents are here, and I suggested they go to Victoria because that's where the baby's going to be born. And people work their way around things.
Yeah. And I'm quite happy to fly somewhere. I've flown to Townsville, I've flown to Adelaide, I've flown to wherever. You just get up at 5 o'clock in the morning, get on, Queensland's a fly-in, fly-out state. Well, we're fly-in, fly-out
Intensive
council.
counselling sessions at Qualia. I think that's really
Yeah.
good. All right. Well, I'm sure there's still lots of questions out there, but maybe you can take them offline. I'd like you to thank our panelists today.